Hi and good morning. My name is Dr. Amira and I am a medical officer at Usim Hospital. So may I know your name and your age?
Hi doctor, my name is Aisha and I am 22 years old.
Okay, so may I know the reason why you come to the hospital today?
I come to the hospital today because I've been experiencing stomach pain since last night and it's getting worse, so I decide to come here and get it checked.
Alright, so may I know which part of stomach that you feel the pain?
The pain is mostly in the lower part of my abdomen, kind of in the middle and slightly to the left side.
Alright, so was it sudden or gradual?
It started gradually, actually, and then it began as a mild discomfort last night, but by this morning it has gotten quite painful.
Okay, so can you tell me how the pain feel like? Is
Uh,
it dull or cramping?
it feels like dull, itching pain most of the time, but every now and then it gets quite crampy, like strong period cramp, but worse than usual.
Mm. So is the pain continuously or does it come and go?
It's mostly there all the time, but the cramping comes and goes in waves.
Okay, so does the pain spread or move to the other part of your body?
It stays mostly in the lower abdomen, but sometimes I feel it radiating to my lower back as well.
Okay, so have you ever had these symptoms before?
I have had a mild stomach cramps before during my period, but nothing like this. Feels very different and much more intense.
Okay, so this is much more intense like before. Mm, do you have any other associated symptoms like vomiting or food nausea, or do you have any fever?
Yes, I felt very nauseous since last night and I vomit once this morning. I also feel warm. I checked my temperature and it was 38.1. So I think I have a fever.
So do you have any cough or shortness of breath?
No cough and no difficulty breathing. I'm fine in that regard.
Okay, so on a scale 0 to 10, where 0 is less pain and 10 is the worst pain, so what number would you give to your pain?
I would give it 8 out of 10, doctor. It's really quite painful and it's making me very uncomfortable.
Okay, so sorry, so this is quite sensitive question. So are you smoking?
No, I don't swear at all.
Mm, do you drink any alcohol?
Also, no, doctor.
Okay, so when was your last menstrual cycle, or are you on period right now?
My cycles are usually regular, every 28 days or so.
Okay, so have you had any problem when you peeing? Is there any bleeding or pain sensation?
Yes, actually, I've noticed it's been a little painful when I urinate since this morning. No bleeding though, just a slight burning sensation.
Okay, so have you noticed any blood in your stool?
No, I haven't noticed any blood in my stool.
Okay, so does eating or moving help relieve this pain?
Walking and moving around make it worse. I feel slightly better when I curl up on my side with a pillow against my stomach.
Okay, so do you take any medication? Does it work? Does it worse or relieve the pain?
I took ibuprofen last night that I hope that it will help like it does with my period cramp. But then it barely helped all the time.
Okay, so do you have any medical illness?
I don't have any chronic medical condition, but
Okay, so are you allergic?
yes, I'm allergic to penicillin as it gives me rash.
Okay, so do you have any surgical history?
No, I have never had any surgery before.
Okay, um, is there any family members or friends that had a same symptoms as you?
No, none of my family members or friends have similar symptoms as me.
Okay, so do you have any travel history recently?
I actually traveled to a nearby city about 2 weeks ago for a university trip, but just for 3 days, and I didn't go abroad or anything.
Okay, so Miss Amni, so I think we already almost to our conclusion. So So basically, when I summarize to your problem, you have been experienced this lower abdominal pain for the past 12 hours, and which is gradually, and you mentioned that it's located on your lower abdominal, slightly to the left, and then you mentioned that it is a dull itching and with the cramp, which is it is worse than your usual period, and then you said you mentioned that it's spreading to your lower back, and you rate it 8 out of 10, which is almost severe of the pain. And then you have these associated symptoms, which is nausea and vomiting and fever. And also you notice that there is a burning sensation when you peeing, and there is no bleeding. And you mentioned that there is no bleeding on in your stool. And then your last menstrual cycle were 3 weeks ago, and you're not on your period right now. So you have no medical illness, you have no past surgical history, and you just known with allergy to penicillin. And then and then you mentioned that when you're moving or eating, it's getting worse, right? You mentioned that you took ibuprofen to relieve your pain, but it's actually it actually gave minimal relief to your pain. And then you're not drinking alcohol, and you're not smoking. And you mentioned that 3 weeks ago you just went to a nearby city and no international travel. So is there any information that I missed?
No, doctor.
Okay, so do you want to add anything?
No, doctor.
Okay, so I think we can proceed to a physical examination. So that's all. Thank you.
Thank you, doctor.